Next on Sisterhood of the Second Act.
It is time to start taking care of yourself. Women are often told they need mammograms, but there are other preventative screenings we should be getting as well. Dr. Kate Burmaster explains what screenings are key for preventative care. Rhonda Banner got the diagnosis that every woman fears, breast cancer. The yoga instructor found the support of good friends and the lessons learned from yoga helped her find her voice, which ultimately saved her life. We'll meet both these women on this edition of Sisterhood of the Second Act.
Sisterhood of the Second Act is brought to you by Step out the door with confidence, ready to conquer the day. Whether you are going to the cafe down the street or headed into work, you know you will always look your best in Cabby Styles. Your stylist, Darlene Marshall, will help you pick the styles that make you sparkle. And Cabby has styles for all body types. Call Darlene at 540-330-6819, 540-330-6819, and follow her on Instagram at Dapper Darlin. Buy local this holiday season and get unique gifts on time. Start your shopping at the New Moon Network store for original artwork by the Virginia artists featured on the Sisterhood of the Second Act set. You will also find Sisterhood merchandise there. Stop by the Earthworks Artworks Gallery at 228 South Pollard Street in Vinton, or shop online at newmoonnetwork.com and have it delivered to you. Your purchase supports Virginia artists and local programming by the New Moon Network. There's more inside the hemp mill than CBD products. There's a community. Stop in for Friday's Coffee Talk to enjoy free hemp coffee and treats. Patent pending products made from hemp for anxiety, pain relief, and organic healthy eating. Cannabinoid products you can trust because the hemp is locally grown, processed, and formulated by us with patent pending formulations. That includes our Pet Calm and dog biscuits. The Hemp Mill, women owned and operated with nutritional offerings, local cards, gifts, jewelry, and trending fashions made by women-owned businesses. TheHempMill.net.
I'm going to be an oak tree.
I think I'll be a dogwood tree.
My kids said they be looking for a thorny tree for me.
With Evergreen, you can be a tree. Our biodegradable urn combines your ashes, natural soil additives, and a native tree of your choice. Be a tree and grow for tomorrow.
I want to be a tree.
Learn more at evergreenmemorialtrust.com.
Now from the Fox Radio Roanoke studio, here's Kathy Heberly.
Welcome to Sisterhood of the Second Act. I'm Kathy Heberly. Even if you feel well, you should still see your provider for regular checkups. These visits are key to preventative care. Dr. Kate Burmaster is an internal medicine physician with Lewis Gale Physicians Internal Medicine in Salem, Virginia. Thank you for joining us today.
Thank you, Kathy.
A lot of women forego yearly exams because they feel great. Why is that exam so important to get?
Well, that's a great question. So first of all, I think having a good primary care doctor that you trust is the most important thing for many women. So, if it makes you cringe to imagine scheduling an appointment, that's a bad sign. I would think about getting a new one. But at the bare minimum, seeing them, once a year or so is important, even if you're feeling really well, to check in on things. Many diseases may not have obvious symptoms at first. And, if we don't check labs or your blood pressure or talk about things, we may not know about them until too late or relatively too late. It's also key that you know your doctor so that when down the road stuff does happen, you have someone who can help you through that and sort of understands your situation and where you're coming from.
Okay, so you mentioned this, but part of any exam is a blood pressure test. Are there symptoms of high blood pressure, and what are the dangers of high blood pressure? Because that seems to be a very common concern.
Absolutely. Hypertension is probably one of the most important things I treat on a day-to-day basis. It's incredibly common, and if untreated, it can have a lot of devastating consequences. So a normal blood pressure is considered anything less than 120/80. 120 is the systolic or top number. 80 is the diastolic or bottom number. Once you get up into the 120s or 130s or higher, that would be considered hypertension. And often there's not going to be any symptoms at this early stages. It usually takes till that top number gets to around 160 or even 180s and higher for people to start getting symptoms like headaches, vision changes, chest pain, abdominal pain. If you have any of those symptoms and your blood pressure is severely elevated with that top number above 180, you should call 911 or go to the emergency room.
Oh my goodness. But are there non-medicinal ways to treat high blood pressure?
Absolutely.
Okay.
So once we identify, early stages of high blood pressure, there are key lifestyle modifications that really apply to anybody. And for some people, if it's pretty mild, that may be all it takes. You may not even need to start a medicine. The first one I talk to folks about is dietary salt restriction. So keeping your salt to 1.5 to 2 grams a day is ideal. You can also think about using salt substitutes, which are usually potassium-based, as long as you don't have any kidney issues or high potassium issues. And it's always best to check with your doctor if you don't know. A couple other things would be a healthy diet, high in vegetables and whole fruits, whole grains, dairy products, and really trying fish and lean meats, but really trying to avoid like sugar-sweetened beverages, desserts, white carbs like white bread, white rice, anything that's really going to spike your hormones and insulin levels and then cause you to be hungry down the road. Diet, I mentioned diet, but exercise is also key. Exercise can significantly decrease blood pressure. Decreasing alcohol intake can have a huge effect. I've had some patients on 5 medicines drinking very heavily, and when they cut back, they are able to come down to 1 or 2 medicines.
I didn't even know that.
Yeah, and another one similar that is untreated sleep apnea. So that can increase the blood pressure, and treating that can make a huge difference for those folks.
That's really excellent, really very good, very helpful information to know for people. We are talking with Dr. Kate Burmaster about preventative medicine, and we hear about mammograms. What are the latest guidelines for when we should get screened?
That is a great question. So breast cancer is the most common cancer in women. Screening is critical for prevention and early identification. For average, which is low-risk women, so average is considered low risk when we look at this, we recommend women start screening between ages 40 and 50 and every 1 to 2 years. There's a lot of different guidelines between societies, so really it's best to talk with your doctor and figure out what's going to work best for you.
And who is most at risk for breast cancer?
So the biggest factors that influence risk are going to be age and being a woman. So unfortunately, we can't really control being women and we can't control getting older. Breast cancers can be seen in women who are younger than 50. They can also be seen in men, very rare.
Oh, okay.
The other big risk factors are going to be having a personal or family history of breast cancer, particularly if you have a genetic syndrome like BRCA1 or BRCA2. Those have a very high risk of breast cancer. There are a couple other factors that can impact it, such as when you begin to have periods or how late you go through menopause, hormonal replacement therapy. A couple of factors women do have control over are going to be exercise, physical activity, staying at a healthy weight after menopause, and I think that's all.
That's a tricky one, that last one. But how important are self-exams, and can they really help you find or identify breast cancer?
Good question. So for a long time, we recommended women do self-exams, often, while they're in the shower or something like that. Many of us heard that growing up. However, we've done studies that show that these exams are not very good at detecting breast cancer. Many women feel very uncertain about what they're feeling, and often what they're feeling is normal variation. So studies showed it wasn't very good, and then there were harms. Women were getting biopsies for benign disease. So what I recommend for women is not a self-exam per se, but what we call breast self-awareness, which sounds sort of silly, but essentially it means pay attention to your breasts, know what they feel like, check in on them regularly. If you notice new lumps, asymmetry, nipple discharge, skin changes, pain, that needs to be evaluated right away by your doctor.
Thank you. That's very helpful. We are talking with Dr. Kate Burmaster about preventative medicine. All through our reproductive years, we've had pap smears. Is that something we should consider as we age?
Absolutely. So pap smears are designed to help us detect cervical cancer, which is a cancer that's caused by a sexually transmitted virus, the human papillomavirus. Risk certainly does decrease as we age, but it is still important to continue with that screening. We recommend starting at age 21 for sexually active women, and in the 20s we do it every 3 years. Once you turn 30, we recommend doing that pap smear every 5 years along with an HPV test, and as long as that's normal, when you're 65, you can think about stopping.
Okay, so I think that kind of goes into my next question, which does cervical cancer remain a risk as we age?
So it does, but it decreases because, like I said, pretty much all cases of cervical cancer are associated with that sexually transmitted virus. And because women in their 20s and younger tend to have higher risk sex lives, they have the highest risk for cervical cancer. As women age, that risk goes down significantly, which is why we feel safe letting women stop at age 65, provided they've had 3 normal pap smears in the 10 years preceding that.
Okay, that's also very good information. So a lot of this, I maybe have heard, but I think the way you're presenting it is making it easy for giving like highlights of things just to be aware of.
Well, good. That's how it should be.
Really appreciate that. What we hear a lot about colon cancer in men. I'd like to know, what is the risk to women?
So colon cancer is a huge risk for women as well. It's in the top 3 most common causes of cancer in women. So it's breast, lung, colon. So we are just equally at risk. It really is men. And those 3 cancers that I just mentioned, breast, lung, and colon, are responsible for about 50% of the cancers in women in 2020. So if you are talking to your doctor about those, you're doing a huge role to decrease your risk. The lifetime risk for colon cancer for women is 1 in 25, which is 4%. Men is 4.3%, so just a little bit higher.
Okay. So while ovarian cancer represents only about 4% of cancers in women, is it one that impacts older women at a higher percentage? And who is at risk? Because our audience tends to be women over 50.
Yeah. So ovarian cancer is not a very common disease. However, when we do diagnose it, it's often diagnosed sort of late in the presentation, which is associated with a poor prognosis. There are folks who have, again, genetic syndromes such as the BRCA1, BRCA2, or also Lynch syndrome, who are at a particularly high risk. Up to 30 to 60% of those patients will develop ovarian cancer. So those are a very important population to talk about screening. Other risks, again, are going to be, starting periods early, going through menopause late, anything that would have you more exposed to hormones over the course of your lifetime.
So the number of pregnancies?
So actually the more often you're pregnant can decrease your risk for ovarian cancer because you're going to ovulate less frequently while you're pregnant and breastfeeding.
Oh, okay.
Well, you won't ovulate at all during those times, but you'll ovulate less frequently over the course of your lifetime.
Okay, all right. Yeah. That's also something I was not aware of. So the last question that I have for you is, what role does diet and exercise, you've alluded to this, but I'd maybe give us a little bit more on your take. What role does diet and exercise play in maintaining a healthy blood pressure and also in our fight against cancer? So
I think diet and exercise are the 2 of the most important factors that pertain to our health and things I talk to every one of my patients about. As we've mentioned, as we discuss these various cancers and blood pressure, as well as many other diseases, those 2, having a good, healthy diet and regular exercise can go such a long way to preventing those things. If every patient I saw had good diet and regular exercise, half of what I take care of would just disappear. And so it is foundational to aging gracefully and staying active and into your later years.
I can so appreciate everything that you said, and I worked myself very hard on both of those. So anyway, this was very, very informative. It's very exciting to hear all of these things that we can do on our own behalf. So thank you so much for being with us today.
You're welcome.
In wrapping it up, we will have Dr. Burmaster on our contact information on our website, sisterhoodofthesecond-act.com. There's more Sisterhood of the Second Act ahead. When it comes to our health, advocating for yourself can be the difference between life and death. We will hear how one woman saved her own life by speaking up.
Buy local this holiday season and get unique gifts on time. Start your shopping at the New Moon Network store for original artwork by the Virginia artists featured on the Sisterhood of the Second Act set. You will also find Sisterhood merchandise there. Stop by the Earthworks Artworks Gallery at 228 South Pollard Street in Vinton, or shop online at newmoonnetwork.com and have it delivered to you. Your purchase supports Virginia artists and local programming by the New Moon Network. Step out the door with confidence, ready to conquer the day. Whether you are going to the cafe down the street or headed into work, you know you will always look your best in Cabby Styles. Your stylist, Darlene Marshall, will help you pick the styles that make you sparkle. And Cabby has styles for all body types. Call Darlene at 540-330-6819, 540-330-6819, and follow her on Instagram at Dapper Darlin.
I'm gonna be an oak tree.
I think I'll be a dogwood tree.
My kids said they be looking for a thorny tree from me.
With Evergreen, you can be a tree. Our biodegradable urn combines your ashes, natural soil additives, and a native tree of your choice. Be a tree and grow for tomorrow.
I want to be a tree.
Learn more at evergreenmemorialtrust.com.
There's more inside the hemp mill than CBD products. There's a community. Stop in for Friday's Coffee Talk to enjoy free hemp coffee and treats. Patent pending products made from hemp for anxiety, pain relief, and organic healthy eating. Cannabinoid products you can trust because the hemp is locally grown, processed, and formulated by us with patent pending formulations. That includes our Pet Calm and dog biscuits. The Hemp Mill, women owned and operated with nutritional offerings, local cards, gifts, jewelry, and trending fashions made by women-owned businesses. TheHempMill.net. Once again from the Fox Radio Roanoke studio, here's Kathy Heberly.
Welcome back to Sisterhood of the Second Act. I'm Kathy Heberly. Rhonda Banner has been a yoga instructor for 16 years through her business Body and Soul Yoga. She has seen the practice change the lives of the women she teaches, and she often says it helps save her own life. She joins us now to tell us more. Thank you for joining us, Rhonda.
Oh, my pleasure. I've been looking forward to sharing this with women and letting people know about my journey, hoping that that could make a difference in another woman's life.
Thank you, because you are a breast cancer survivor.
I am.
And so tell us a little bit about what led to your diagnosis?
Well, it wasn't in the usual way, right? Typically thinking that I would go to a breast surgeon and they would diagnose me and then kind of give me the care that I needed. Well, it took about 4 doctors before I got a clear diagnosis. And yes, the first 3 doctors I went to were unwilling to do further diagnostic tests. The first one said to me, you have a cyst, and she did do a FNA, a fine needle aspiration, and she said it's suspicious. And I remember I was walking out of the library when she called me with further, with her direction, and she said, you need to come back in here and we have to do surgery. So it was very shocking to me, and I was like, okay. So I made the appointment, I went back in, and I had done a little research, and I said, can we do some further diagnostic tests? And she said, no, this is what we're going to do. I was just shocked, and I said, I had a list of questions, and then she cut me off. She said, I have a waiting room full of patients, and you need to schedule your surgery, basically pay your deductible, call the administrative staff of the hospital, and come on in and get the surgery. She walked out, and I was really shocked. Another assistant came in, and I said, I felt like I was just treated like a cattle, like I'm not comfortable. Yes. And she said, I'm really sorry about that. I left, and I thought about it. It was challenging dealing with the administration of that hospital. They wanted me to immediately pay a $5,000 deductible, which the insurance company said was not even necessary. But I walked away from that hospital. It was a struggle to find 2 other breast surgeons on the particular plan that I had, the health insurance. But I did find 2 other ones, and they basically neither one wanted to take the time to do any diagnostic testing. And I was not comfortable with that because I'm a thorough person. I believe, that even a carpenter will measure twice and then cut once, or at least twice. And they didn't want to do any further diagnostics. So thank God someone referred me to a plastic surgeon. I went to this plastic surgeon. He listened to me. His name was Dr. Rausch in Hackensack. He was very kind, caring, and he said to me, I was emotional at this point because I was getting a little scared. Yes. And he said to me, Rhonda, don't worry, I will get you on the right track. We will take care of you. And yeah.
I am shocked. But so even though your initial doctors were women, obviously you were not satisfied with your care. So it sounds like then the next step, what did you do? Was it to see this?
Yeah, so then
person?
he referred me to a pathologist, and he said, this pathologist is very good. And the pathologist did do a diagnostic test, and he came back in, and he said, you do have breast cancer.
Oh, wow. And then, so do you have, is this true that you found out that your family heritage predisposed you to breast cancer?
Yes.
Is this true?
Yes, that same plastic surgeon, he had asked me if any of those 3 doctors told me about the BRCA test, the BRCA, which is the test for breast cancer gene, if you have it.
Oh.
None of them had told me, none of the 3 women, so that was really surprising.
Yes.
So he said it is a genetic testing, and it'll tell you if you're predisposed to having breast cancer, and maybe even the breast cancer will come back again at a later date or in the opposite breast. So with him giving me that direction, which was very useful,
yes.
I decided to have a consultation, and I did have the breast cancer test, the BRCA test.
You did have it done. So what course of treatment did you decide for yourself?
Well, after the test coming back, and I was positive for that particular gene, I just felt that it was in my best interest to have a bilateral mastectomy with breast reconstruction, just to protect myself so that I could prevent the reoccurrence of breast cancer coming back, and maybe the next time I wouldn't find it, or we wouldn't find it.
Right.
So this way I didn't have to worry about it. It was done, and that was it.
I agree. So after you found the right doctor, you need to advocate for yourself. Your need to advocate for yourself did not end there. You told me good friends and your gut led you in the right direction. Can you explain that a little bit, please?
Absolutely. So after I found the right doctor, who was Dr. Habibi at Johns Hopkins in Baltimore, amazing institution, a fabulous doctor. So firstly, he listened. He gave me options. You know, I could see he cared. I knew he had my best interest at heart. So after I found him, we set the surgery date. We did do a few more diagnostic tests. We did do a future, we did a further MRI. At Hopkins, they did an ultrasound, and I think one other test that and I had the genetic testing.
Okay.
We knew now what we were dealing with. So at that point, surgery was scheduled. It was now May of 2009, 5 months after I felt this initial lump in my breast. So it was 5 months. I was really getting worried. And suddenly I got this premonition, a gut feeling that this cancer was aggressive. So I called to ask if they could please move my surgery up. I was really kind of feeling, scared. And the scheduler said, no, we can't. She was very blunt, unfortunately. And so at that point, I spoke to a couple of my friends, and they said, Rhonda, do not take no for an answer. You call back again. So I thought, oh my gosh, I called back again. Again, she said no. And I was like, oh my goodness, she's going to kill me. And my friends again said, call again. So I called again. And thank God, at this time, I got a voicemail that she was on vacation. And she said to go directly to your doctor. So I was like, why didn't I think of that to begin with? But I called Dr. Habibi. He was very compassionate, and he said, Rhonda, I'll get you a different plastic surgeon to do the second part of the surgery. Let me work on it. So in 24 hours, he scheduled the appointment. He moved it 2 weeks earlier. So we had the surgery. I had the surgery, and I think it was May 9th. And after surgery and the pathology report came back, he called me and he said, Rhonda, it was a good thing. It was a good thing that we moved the surgery up, because you had a very aggressive breast cancer.
Oh my goodness. Yeah. So you listened to your intuition, and your friends supported you.
Encouraged me.
And encouraged you. That's what we all need. That's what we all need to hear. All women need to hear this very much. We are talking with breast cancer survivor Rhonda Banner, and I'm so delighted to have you here. So throughout all of this, you were doing and teaching yoga. I'm so fascinated by this. How did that help you through the diagnosis and subsequent treatment?
Yes. So, yoga is a philosophy. Some people think it's a religion. It's not. It's a philosophy, and it has its foundation in both spiritual and ethical practices. So these practices offer practical and relevant tools which are very useful in today's world. So what happened while I was practicing some of the yoga poses, they help me build courage and confidence. So when I needed that courage and confidence to walk away from the doctors that would not do further diagnostics, I was able to walk away with confidence that I would be led to find the right doctor.
Excellent.
And the other way in which it helped me is it helped me to pause and breathe and to widen my perspective. So in having a broader perspective, I realized, and this is a yoga philosophy, well, not just that, but I realized I'm not my body, I'm not my mind, and I'm not my thoughts. Yes, I have a body, mind, and thoughts, but who I am is divine essence. So knowing that I'm divine essence, I was able to approach the bilateral mastectomy with courage, with confidence. I asked people to pray for me, and I was able to have a broader perspective knowing that God had me in the palm of his hands and that I was safe and that all was well.
I love that so much.
Yeah.
Now, you have been teaching some of these women for nearly a decade. What changes have you noticed in them, particularly physically and mentally?
Yes. So physically, I've seen my students become more flexible. I've seen them have greater balance and greater vitality. Many of my students are baby boomers. I mean, I do teach younger students too, but the majority are baby boomers. And I also notice that they look more relaxed, especially at the end of class, more joyful, more mindful, more peaceful, and just content in their lives. And lastly, I've had many of my students share with me that they made lifestyle changes. 2 of them in particular lost 30 to 40 pounds. One of them has said, Rhonda, I want to become, more positive.
Right.
And she did. And just more, I've seen the students become more open, more expressed. And I look at each one of them as they take better care of their health. And I'm so joyful to look at them because they look like a flower that's just like blossoming and opening up.
So you've mentioned several. Are there any other health benefits of yoga that you would like to just put out to our audience?
Yes. So yoga has many benefits on all levels. The mind, the body, the spirit, and for physical, mental, emotional, and spiritual.
Okay.
So yes, on the physical level, yoga improves strength, flexibility, and balance, and can relieve lower back pain as well as the aches and pains associated with aging. On a mental level, yoga can relieve stress, quiet the mind, improve resiliency and focus, and can help you sleep better. On an emotional level, yoga can help you feel calm, centered, peaceful, and relaxed. And on a spiritual level, yoga can help you experience your divine essence, and which is your soul, your Atman in yoga. And then as you do that, it could help you be of greater service in the world.
I love it. So what would you like women listening or watching to take away from this conversation?
Well, I would like each and every woman to know that, each one is valuable, each one is unique, and that no matter whether you're speaking to a doctor, female, male, trust your instinct. If you're not getting the service that you need, walk away. Your life matters, and you're here to make a difference in this world.
Thank you so much for being here, Rhonda.
You're welcome. My pleasure. And as we say in yoga, namaste, which means the love and light within me honors the love and light within you.
Oh, thank you. We will have Rhonda's contact information in our show notes on our website at sisterhoodofthesecond-act.com. And we will be back to wrap up the show after this.
Kathy's wardrobe provided by Cabby stylist Darlene Marshall. See the styles in our show notes at sisterhoodofthesecond-act.com.
See where a grateful nation remembers its heroes, and where Thomas Jefferson came to relax. Where small town charm is just down the road from big outdoor adventures. Find peace and quiet, as well as the sounds of family fun. Destination Bedford is located where the Piedmont Plateau meets the Blue Ridge Mountains of Virginia. Where ordinary ends, Bedford begins.
I want to thank Dr. Burmaster and Rhonda Banner for reminding us to be intentional about our health and to take care of ourselves. I'm Kathy Heberly. Join us next week for another edition of Sisterhood of the Second Act.